स्टार्ट हुआ?
Just 2 minutes.
1 minute.
Okay.
बाहर ठंडे शर्ट है।
One minute.
Sorry, your presentation went off.
Yeah, I know. I will go again. I'll have to. You'll have to send me the link, right? Or no, I'll just go there and share my screen. Okay, just give me a minute.
Ashok, are we live?
Yeah, we are live. We can go ahead.
आया मेरा स्क्रीन आया?
Yes, but your video is not on, sir.
अभी वो वापस मैं करता हूँ।
iPhone का खाली on करो।
अब वो आईफोन का ही वही कर रहा हूँ मैं, 1 मिनट।
iPhone, if you come, you are already online. iPhone में just open Zoom and then your video will be seen.
Yeah, that's what.
Yes, now it is seen. Good evening, everyone. Okay. Good evening, everyone. We welcome you all to Financial Friday webinar series on Ortho TV Online. Today we have a very eminent orthopedic surgeon, or I should say a retired orthopedic surgeon and a retired professor of orthopedics. He has been my teacher and he has been my mentor for the last 15 years. He has helped me organize VIROC 2017. He is Dr. CJ Thakkar, and recently he became a licensed airplane pilot, and we all enjoyed his lecture and webinar on the flying. Now, we also have on the panel Dr. Sachin Kale, who's a finance enthusiast as I look at him, for all my tips and tricks related to the share market and mutual funds. So over to Dr. CJ Thakkar to start his presentation.
Hey, give me the meeting ID again. Just tell me this thing.
You are already online, sir. We can see you.
No. No. You can see, but my wife wanted to join. So
I will send her. I will send her.
How will you send? You don't have her email, her phone number or anything.
आपको
so you tell me, I'll just. नहीं वो वापस मेरा WhatsApp खोलना पड़ेगा ना, तो just tell me the meeting ID and this thing ना quickly.
It is 899 8762 6651
6651. Join the meeting and password
187902.
187902. Sorry. Unable to access camera. Yeah, join with video. Okay.
Sir, we are live on YouTube.
I know. Just give me a second. She is my finance person. If she doesn't join, I'll be stuck.
I would have given you the link, that Ortho TV link. She would have been able to easily see on that much more easily.
नहीं हो रहा था इसके लिए.
वो तभी होगा जब ये चालू होगा सर.
हाँ चालू हो गया. चल. Okay. So let's start. Should I go on?
Yes, please.
Okay. So let people just warm up. all of you want to have a car, bungalow, and aircraft like that. I have. And that's why they asked me as to how do you invest and where do you invest? This was a question which was asked to me. And then I thought about it, and I'm not a financial wizard or an expert. So I said, I can share something which I did in my life to become successful. Um, so, what do you want actually in life? You want money or you want to create wealth? That's the first question that you have to ask. Because making money is not very difficult. There are so many different ways of making money. But when you want to create wealth, it is money plus something else. And that is what I think we as orthopedic surgeons or as professionals should aspire to. Now, let's ask this question, Ambani's, Birlas and Tatas, all are moneyed, right? But whom do you value as far as the wealth is concerned? I think answer would be Tatas because they have something which is called, the credibility. Others have money, but they have credibility. So this is what we should also aspire to be. And when we talk about our first citizen, the presidents, we had so many presidents, but whom do you remember, fondly remember and love? I think it was APJ Abdul Kalam. I think he will win hands down. And how much money did he have? When he passed away, he had probably 3 pairs of clothes and plenty of books, but he was bigger than life size. So if you want to aspire like any of these people, then you require to create wealth. And when you talk of wealth, we think of going to financial advisors and all those people, and they show you the rainbows. And they say, oh, look, there are 2 rainbows, and you can definitely catch this rainbow with our help. I think Meena will be here, must have joined. And it's not any sort of derogatory remark for them. But when you want to create wealth, it is already in your hand. You can see you have an umbrella in your hand, which is rainbow color. So wealth creation is our hand. And how do we do that? So let us look at it. Uh, Doctors are poor at creating wealth. That is most of the time, they say. Doctors earn well, but at the same time, they spend a lot of money. They start earning at a very late stage in life. And, they don't sort of save properly. They have big houses, big cars, very expensive clothes, go to expensive restaurants. And that's why they don't create wealth. That's what people say. So what you have to remember is that earlier you start investing, better are your chances of creating wealth. And first of all, as we doctors, we know health is wealth, but how many times we look after our health? Physical fitness is one thing, not everybody likes to go to the gym, but playing some sport, which requires some amount of physical energy. But I found what is important is that we don't relax adequately. How many times we go on vacation and the first 2 days we are thinking about the last patient and how we manage, and if there was a complication then the whole vacation gets fired. And when we are about to come back another 2 days, we think, oh, now how are we going to plan our next surgeries, or how are the appointments given, or what are we going to do with blah 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 blah. So adequate relaxation, I think, is one thing which we must learn, that moment you are out of your office, your mind is closed, your mind is shut. You don't think about your work. That is the only way I think you will be able to maintain your health. And they say you must work hard, but enjoy harder. Uh, as far as the wealth is concerned, of course, money is important. But what is most important is reputation. Once you create a reputation of being honest, straightforward, and maintain it till end of your life, you don't have to worry about money. It just flows in. Family is first thing in my life that I must, look after and be with the family. I mean, there is no use earning so much of money that you are away from the family and your child also does not recognize you. And the friends, of course, and good colleagues. But what's again the most important thing is at the end of your life, there should not be any regrets that, I did this thing wrong and purposely wrong. We all make mistakes. But if you have done purposely wrong, purposely done a wrong surgery or given a wrong advice, I think that will pinch you till you die. So never do that. When should you start creating wealth? Well, moment you listen to this, or if you have not already done it, start it immediately. Stephen Covey, if you have read his book of 7 Habits of Highly Successful People, which was given to by my fellow Abhay Alhans, and that really opened my eyes that we already have our circle of concern, but our circle of influence should be bigger than our circle of concern. Because if the circle of concern is bigger than influence, then you are doomed. So you have to create influence. And how do you create influence? And that is what I'm going to talk about today. Now, as you know, there are 3 decades in life of a professional. In the initial first decade, there is a lot of time, but there is no money. Then probably there is equal distribution of time and money. And the last phase comes is when there is no time and you have plenty of money and you don't know what to do with it. And if you survive these 3 decades, then the fourth decade is what you get is bonus. Now, when you talk about no time and money, a famous surgeon, he was always away from his wife and family. And when he died, his wife then decided to get married to his driver. And then the driver thought and said, "Oh, I thought I was working for him, but now I realize he worked his whole life for me. So don't earn so much that you can't spend when you have retired. I mean, your aim should be that when I die, there should be nothing in my bank. Because if whatever you leave behind, of course, for children and other things, it's okay. But beyond that, whatever you leave behind, you have unnecessarily wasted your life earning that money, which is of no value. In initial part of the life, your availability is important for professional. But in later part of your life, your non-availability is important. If you're not available, you are a big doctor and people will run after you. And was told to be my friend Charles Pinto, who is a psychiatrist. And he told me very, very beginning of my practice. So I still remember his golden words. So in the first decade, the typical scenario for an orthopedic surgeon, a resident who has passed out, he is struggling to make 2 ends meet. So he has some 2 hours of cabin time in a polyclinic. And then, during his daytime, he works as an assistant, does some job in the hospital so that he can get some experience as well as the money. And he's busy running around and developing his contacts, with other professional colleagues. And this is a typical scenario. You don't have money, but, you're trying to now become bigger. And in this first decade, what do you do with your time? So, of course, you nurture your context, but you enhance your knowledge and skills. And this will remain till all the 3 decades. Initially, you must enhance your computer skills because, there are a lot of things which you can do with computers today. And unless and until you have all the skills and you can navigate yourself really well, it's very difficult to survive today. And don't forget family, hobbies, and travel. I mean, that starts right from the day one. I mean, if you neglect those, then your life will not be as comfortable as when in the end what you want it to be. Now, what do you do with your money? So if I had the money, first thing I would buy is a laptop if I don't have one, because with internet I can surf, all the journals and everything and get my knowledge. And then with different programs, I can sort of have my prescriptions in a very nice way. I can keep patient records. I can keep all the X-rays and other things for my reference and prepare my presentation. As far as the money investment is concerned, I will start with PPF because that interest is tax free, and then I would interest in SIPs. That means systemic investment plans, and I would prefer a daily SIP because that will the way I will be able to get the effect of compounding. And mutual funds are safe bet at this stage because you don't want to lose your capital. Another good important thing is gold for wife. Now most of the investors said that don't buy gold, it's not a good thing. But remember one thing, your wife would love to have gold and she'll really appreciate at every anniversary or every birthday you give gold, and that will keep on multiplying. And the gold in a long run gives you a very good return in 2 ways. Number one, it creates a goodwill with your family, because when your children are getting married in our Indian custom, we need to make some ornaments and other things. And if you decide to buy at the last minute at 30 years after your children are grown up, it'll be too late and it'll be too expensive. Equipment, yes, you must buy equipment because it will help you in getting your depreciation and it'll make you earn more money. So no matter what you do in your life at that stage, your practice will be limited. Don't expect, to zoom unless you are corrupt, unless you do all those cutthroat things like operating on the non-indicated patients. But if you're honest, straightforward, no matter what you do, you will have a very limited practice. So the thing is, you must pay yourself first. That means you save first and spend later. So every day, what your earnings are, you realize that, okay, today I have my receipts are X, but my realized income after paying daily rent or whatever you call it, my saving, my total income is X. Then at least 15 to 20%, you just keep it aside. Don't use it. So what I would suggest is, that every day if you put the money in your SIP, it'll grow exponentially, and you'll be surprised how much money you can have. So for example, power of compounding. Say you start, the first column is you begin at the age of 20, and every year you save only 2,000 rupees, and only for 10 years you save. So your total investment is 20,000 rupees, but you will take home at the age of 65 about 5 lakhs of rupees. If you start at 30, you will have to invest for 35 years. Your investment will be 70,000, but you will earn only 4 lakhs. And at the age of 40, if you start saving, then naturally you have only 25 years probably. And then, your total saving will be you will save 50,000, but you will at the end of the day carry only 1,80,000. So, the earlier you start, better it is. And, one day, Satish Mutha said that, how much you require? I said, how much you require to retire? You have to decide. I sent him a sort of a table which I can share with you, which Meena gave it to me, where you calculate, which I'll show you at the end. And he said, you require 20 crores to retire. I said, I never said that you require 20 crores. This is what is, given in the table. But if you invest 10,000 rupees per month for 35 years, your total investment would be about 42 lakhs, but the value will grow to about 2 crore 30 lakhs at the 8% monthly compounding. So, and these are, tables available on the internet, and you can just put in your how much you want to save. So if you realize, if you save daily, even 500 or 1,000 rupees, how much you will be having the money when you retire, it'll be phenomenal. You won't be able to even use it. In the second decade, almost everything remains the same, as far as the time is concerned. So enhancing knowledge and skills remains. But now you should, from our experience, start teaching. Because teaching is the only way you will be able to learn better. And then you should, do some social activities like, getting into Lions Club or some charity organization where you develop context from other fields, and which will broaden your outlook. Because normally, we attend US clinical meetings and some such programs, but we never go out and see how other people live, like lawyers, chartered accountants, and other people, or even the businessmen. And you will be able to learn a lot from them. And again, family, hobbies, and travel remain the same. As far as the investments are concerned, again, SIP, mutual fund remains same, but you add equity now, because now, you can lose some money if at all, if anything happens in the equity. And a new thing which is there, one of my neighbors who is working with Kotak Mahindra Bank, he invests in art. And all these beautiful paintings that he has, he bought it for 10,000 or whatever, and today they are costing lakhs of rupees. So this is another thing you must look at it. Now, I'm not an expert in any of these. Okay, so I take help of experts when I want to invest in any of these mutual fund or equity or art, because like we are experts, there are other experts, and they help you out. And I'll tell you, Meena, how she helped me. She says, doctor, you require money to pay your advance tax, right? How do you do? So I said, well, whatever is there, I'll just, pay it. He says, no, like every 4 months you have to pay. So every month you save 1/3 of it. And when the time comes to pay the tax, it'll still have earned you some money by way of some dividend in liquid funds. And that was a very good advice. Now, at second decade, we always want to have our home, our own clinic. So we start taking loans and we start paying up, and we decide how much it is worth. So these two things, of course, are necessary. Like in USA, people don't buy homes. People who are young, they just stay on rent. But in India, I think we always aspire to have our home, because that is our lifetime achievement award, as we call it. And having our own clinic always is better because you earn also from the collateral things. And of course, equipment again remains, on a priority. Again, this decade, no matter what you do, you will have a reasonably good practice. So you don't have to worry about it. In the third decade, again, the time enhancement of knowledge and skills still remains the thing. You are nurturing your context, you are doing your social and teaching activity, but now you start charity because you have enough money. And charity, when you give something to somebody, it gives you pleasure and it helps somebody who really needs it. Like, when you are a houseman or a registrar, your lecturer takes you out for, a cup of coffee or snack, and you cherish that, you remember that for your life. And then your bosses call you for the party. I won't call it charity, but I would call you is that you feel good about it. So similarly, when you do something good to somebody, you feel good and they also feel good. The receiver and giver both feel good. Hobbies, travel, and family, again, I mean, they don't change in any of the decades. As far as the money is concerned, when you have clinic, now from independent, you are trying to become interdependent. And I'll show you what's the advantage of it. Home is, yes, of course, I would buy, but vacation home, I'm not in favor of it because it's useless. It just lies idle. And you have a small house in Lonavala. You have to keep it up to date. And then, when you go there, sort of your servant would say, "Arey, meri to maa mar gayi hai, main to ja raha hu." So you have to go there and clean it. And every now and then, your wife would say that, "Look, I don't want to come there and clean it." And from that investment which you have, it has a very limited value because when you want to sell it, nobody is there to buy it because there are dime a dozen available. I would spend that money if I want to go on vacation at different places, and I could afford to stay in 5-star. Why not? With that, investment return, which otherwise would be lying dead. And your investment avenues like mutual fund, equity, and art remain the same. And again, I would buy equipment. I bought equipment till I retired, and it really helped me. So here, no matter what you do, your practice volume will now depend on your performance in first 2 decades. How good you were, whatever your complications, whether you are honest or whether you're dishonest. And you see, most of the people in third decade of their journey, they wither out because they have not looked after the first 2 decades. They have not enhanced their knowledge. They have not been up to date. So all those things matter. And this was told to me by one of our general surgery colleagues, Dr. J.B. Shah, who must have retired by now. He was senior to me, he was my lecturer. And he told me that these are the 3 decades in life of a surgeon or a doctor. And in third decade, your performance will depend upon your performance in first 2 decades. So just remember that. So every surgery, every patient counts. Now, buying the equipment, I would buy the best. I would first negotiate the price.
So we lost your audio. Just a minute.
What happened again? Yeah.
We are back. We can hear you now.
Can you see my presentation?
Yes, everything can be seen.
Go ahead.
Okay, well, I can't see my presentation. My presentation disappeared.
Yeah, we can see it.
Okay, but it is not moving now. Okay, no, there's some glitch.
Yeah, possibly
what do I do?
got disconnected. Just reconnect again, sir.
Okay, leave and reconnect. Okay.
Meaning go to the Zoom link and join again.
Okay. Zoom link. Wait a minute. I'll have to go to email. The problem with Zoom link is it's not seen in my iPad. So wait a minute. You give me the meeting ID again. It'll be easier for me.
Public, you will have to go open your email on iPad and do it. It is
no, it's not opening.
Way.
That email is not opening on iPad. That's why I'm stuck. So if you can give me the meeting ID, please.
I will message you if you want. I cannot dictate it because there are many people
just,
on. Everybody will join in using their ID.
Okay. So I'll have to then my iPhone will disappear. Yeah, that's a problem.
I will message you on the iPad.
No, we'll send you message on the chat.
Yes, we'll send you a message on the chat on the iPhone.
Chat on the iPhone.
Zoom chat.
Yes, I have sent it. On the iPhone, you can use the Zoom chat.
Okay. Okay, 1 minute. Zoom chat, Zoom chat. Hey, it's difficult, to handle. Okay, it disappeared. It came and it disappeared. Okay, it's chat. Hey, yeah. Okay, I just keep it on. Oh, it comes and disappears. The problem is that. Okay, give me a minute. I'll go to my message box. Let's see. Okay. अरे नहीं चल रहा है यार वापस.
See if you got this on your iPad.
I'm getting it. 1 minute. Yeah, I got it on iPad as well as here. I don't know what's going on.
Yeah, it's working now. You're back online.
Okay, I'm back online.
Just put on the screen share.
Okay, so as I said, buying an equipment, I would, first negotiate the price and then request for the extended warranty, because I believe in a win-win situation. I don't want to squeeze out and make somebody unhappy, because then he will not be giving you good service. So, and usually when you do this, they understand and they help you. Now, as far as the wealth creation is concerned, they always say that there is a primary income and a secondary income and assets and liability, which all of you know, and you must have attended so many seminars. But what are the avenues for profession, for you, profession or market? My first thing is I would create wealth and money in my own profession. Market is secondary. So in secondary income, like clinic sharing. So if I have a clinic, then I would try to have a radiologist, a small pathology collection center, a physiotherapy, and pharmacy if I have a nursing home, because these will give me an advantage of having everything under the one roof, and it will also give me an advantage of giving better service to the patients. My colleagues will be happy, so they will refer patients to me, and I in this stage also, as I said, I will think of win-win situation. I would not try to cut corners, or I would not try to ask them for discount, because like we don't like to give discounts. Nobody likes to give discounts, and if you don't ask for discounts, you get much more than what you would ask for. And then this I learned very early in my life. Selecting a light specialist, again, select the best. And also never ask them for discount and pay them more than the others. Like the anesthetists, they are always at the receiving end. In fact, if they don't give you good anesthesia, your patients won't be happy. And I'll tell you one story. I had a patient with bilateral hallux valgus, and I called one of my colleagues, and he gave her, sort of general anesthesia, but he gave her more relaxant than more of painkillers. And when she got up, she said, "Doctor, I could feel all the cuts that you are making, what you are talking, and I had so much of pain. I curse you." So you have a good anesthetist, your surgery will be better. And they take more risks than you and me. Pay them better than anybody else. I think that's the secret of success, because if you're a happy patient, post-operatively without pain, they give you nice blocks and all, your practice will benefit. So again, think of win-win situation. If you have a non-medical spouse, then you can generate income from equipment rentals. For example, buy a CPM and give it to your patients, earn some money out of it. Her file is generated, and then you know how to handle money, your money and her money, and how to make two files and how to earn more and generate more income and more wealth. Again, invest in technology. When nobody had digital radiology, not even radiologists, I spent almost about 25 lakhs, because that gave me indirect marketing. People said, wow, he said such good x-rays. I got space suits, and when I took them to Lilavati Hospital, even Dr. Jagannath and Dr. Bhattacharya, they came to see it, and they asked me. I was known figure then, and even navigation. I was nobody in joint replacement. There were already established names, younger ones. Moment I got navigation, I got a head start over them, and I could really compete with them. Now, again, selecting your subspecialty is very important. We have so many specialties, like pediatrics, spine, hand, foot, knee, hip, shoulder, blah, 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 blah. You decide what you are interested in, and also you decide what gives you good money. Okay. I would not go into the details of this. This will another, lecture. But today, in today's time, there are three specialties I think of. Hip. How many people do good hip or hip trauma? So hip trauma, arthroscopy, hip replacement, primary and secondary. You can count people on the tip of your fingers, even in city of Bombay. Shoulder, again, you can just 2 or 3 names come to your mind. Scopy, many more people are doing it, but the advantage is nothing is seen on the X-ray. So unless and until the other fellow does a scopy, all your mistakes could be hidden. So these are, and the scopy is, again, very minimally invasive, less complications. You don't have your own clinic. You can go anywhere and operate. And, you just see the scopy surgeons. They are traveling all over and they're making so much money and no headaches. I mean, they can take off on the weekend and play golf in the afternoon. They don't even have to sit in the clinic. So find out the niche. And, always we were told that, try to master your weaknesses. I think it's something which is, you should not waste your time on. You must strengthen your strengths. So whatever you know the best, you try to improve on that. And like say, I started my life, I give you a very small example, the niche. I started my life with a nursing home and hardly any patients coming in. And what was important was upper end of the femur. So anytime, I said, okay, I'm available day and night. Anybody would call, I would rush with an X-ray machine even in the middle of the night, take an infant feeding tube, pass that, because that's a thing. Old man has started getting up in the middle of the night, wanted to go to bathroom, fell down and can't pass the urine now. So I would put in an infant feeding tube, immediately collect the blood, for investigation. So in case if the patient decided to come to me, I have him ready already and put in an IV line. So the treatment given at home, they will get impressed. And then I will call my friend and anesthetist and say, hey, isko epidural laga dene yaar. So that time, he would put the epidural, patient will become pain-free. And, I could retain my patient. So this is just an example of how you can, survive and can make a niche out for yourself. Now, what we are important is how to increase the conversion rate. You get 100 patients in your OPD, but if only 2 are getting ready for surgery, the conversion rate is very poor. You should try to aim at better conversion rate. So first and foremost, like you go for your MS orthopedic exam and say your exam is in your own institute and the supervisor is your friend. What will you tell him? Hey boss, give me the cases which I know the best so that, I can make a good impression on the examiner and pass. Same thing in private practice, okay? There is nothing succeeds like success. Cherry pick your cases always. Try to do the cases where you can be successful. If you think that you can't be successful, call somebody to help you out or refer to your colleague. He'll be very happy and he will refer his cases which he can't do to you. Because whenever the patient, if you have one complication, 1,000 people will know. But if you don't have a complication, maybe nobody would know, but at least, you don't have a bad name. So always cherry pick your cases almost all throughout your life. The question is, why did we have 4 examiners? Similarly, when you sit in the clinic, you are appearing for an exam with every patient who comes in, the patient would be there and 3 of his relatives. And one fellow will decide how much money to be paid. And others will be asking you questions and making you uncomfortable. So that is why we had 4 examiners, so that you can face 4 people at a time. And, you can multitask and answer and see who is the most important person among these 4 people. Sometimes patient has no say because it's an old lady, he has no say. A husband has no say, but probably son-in-law has a say. So, you have to identify who has a say, and then you have to try to convince him and not anybody else. Then appear to be knowledgeable. Now, why do I say appear to be knowledgeable? Is How many times a fracture intertrochanteric comes to you, you put it, onto the viewing box and say, oh, yeah, the patient requires surgery. Well, that every orthopedic surgeon is going to tell. So, I learned from, in the sense that I had a viewing box which was slanting. It was not a vertical viewing box. So I could put the X-ray there. And this slanting viewing box idea, I learned from Sudhir Joshi, one of my colleagues and my friend. Now, on a slanting viewing box, what you do is you look at the X-ray very nicely, and then you take out the templates, take out the templates of implants and replacement or whatever it is, and put them there. So patient thinks, wow, you are doing something, you are really analyzing it. Now, when did I learn this? I had a patient who came with acetabulum fracture. The relatives brought the X-ray. I saw it, and within 2 seconds, I said, oh, patient requires surgery. And the patient never came back to me. She came back to me after 5 years for a botched up acetabulum, which was not treated, for replacement. And I said, first, you came to me first, right? He said, well, doctor, you did not pay any attention. I said, what do you mean by that? He says, when we went to this doctor who sort of treated me conservatively, he put the X-ray upside down and studied it so much in detail and said, look, you don't require surgery. So we went to him. So appear knowledgeable. Try to create this situation where people feel that you are really studying the case. Number two, give adequate time. Now, what do you mean by adequate time? Everybody likes to talk. So let them talk, not for the whole hour, of course, but for 5 minutes, 10 minutes. So they feel happy and they feel, wow, this doctor, heard me and he talked to me. And then don't answer all the questions. Answer only limited number of questions, because there are people who come only for shopping and, they want to know how much you know, and they want to get operated by XYZ, but they want to know what are their options. So you just answer a few questions. If they ask them too many questions, there are a few tricks to avoid that. You can just ring up your board boy and say, pani leke aana. So that gives them a signal that your receptionist will call from outside the sir, too many patients are waiting. Of course, if there are no patients, then she can say, oh, your boss has called up and, he wants to talk to you. So he said, okay. I can't answer all the questions. Okay, you go and pay the deposit and then, I'll have time to sit down with you. And last thing is, if you can't confuse, this is the industry term. So what I would say is, I don't use it very often, but suppose sometimes the patient comes and, you have decided that I want to do total knee replacement, and patient has heard somebody saying that, I would do unicompartmental. So now you don't want to lose the patient, right? So what you do is you take out all the complications of unicompartmental and show them, look, this can happen, and that can happen, and that can happen. At least if they are not convinced, they'll get confused and they will ask the other surgeon. I hardly use this technique, but as a little fun part, I just wanted to introduce you. 1 minute, I just have order. Now, this is very important. Do not involve yourself in non-operative management, because if people know that you can treat non-operatively, then you will have a line of patients coming to you for non-operative treatment, and your surgery rate will go down. So in that case, I'll refer to a rheumatologist or somebody. At least he'll be happy to treat those patients. He will be able to give more time, and whenever he has a surgical case, he will send it to you. And never participate in seminars or lectures in medical management like glucosamine or osteoporosis or vitamin D3, because ultimately what you present, people will remember you for that. And I have my own bitter experience, because I started my private practice and, I said, oh, I know everything about backache. And, I just gave my first lecture in Bandra Medical Club on conservative management of lower back pain. And till today, people say, oh, wow, you are a very good back doctor. And they still come to me, and I had an OPD full of patients, but 0 surgeries. So don't do that mistake. How can you handle Googlers? Well, I think this requires another full seminar. And I think we should invite some good, people like Ram Prabhu and other people who can guide us, and a panel of people who will be able to tell us. Now, one more thing I forgot to tell you, or maybe it will come later, is that never take a charitable attachment near your primary practice, because what happens is then the patients, you lose your value, and it'll come later. So we'll go to it later. Now, who are your ambassadors? Your ambassadors are your receptionist, your public relation officer, your assistants, your nurses, and your physiotherapist. Now, what do I mean by public relation officer? Now, this term is very badly used, most of the time when we talk about public relation officer. What I mean by public relation officer is, I had a girl who was handicapped, and she would be handling all my phone calls after my office hours. Or say, for example, you have a clinic, and now you can afford to hire people. You can hire a public relation officer, and I will tell a little detail how we can utilize these services. So that's why I put it in blue, and I'll tell you how this can be helpful. If you own a surgical center, for example, always get budget which you give to the patient signed. Identify who are the troublemakers, because there will be some troublemaker who will, otherwise later on come and say, "Arey, itna paisa kyun ho gaya? Ye kyun ho gaya? Ye problem ho gaya." So identify them and pacify them right at the beginning. Keep the relatives involved in the sense that, when you are taking the patient up for surgery, now there'll be 50 people waiting outside. And if the surgery getting delayed, then they'll keep on, bothering your receptions, everybody. So you tell them, okay, I think, the surgery is going to take about 2 hours. So you go and buy this medicine and give a name of a medicine, which is a very simple medicine, but not easily available. So they keep on moving around and they feel involved. And look, I went and got this medicine, and they will have something to talk about and they will not bother you. And collect adequate deposit. Without that, don't start the surgery. No matter how well you know the patient, you will be in soup. So don't do that. Again, the patients usually bargain in your surgical fees. Okay. Patient always want discount, but the best service. What I realized is that patient never bargain in OT charges, in equipment usage in charges. Say, for example, monitor, defibrillator, uh, anything you name it in the theater, you use it, and they'll feel, wow, you're used, you can split that up and probably against your surgical charges. So ultimately you want the same, but under different names. So this is something which I think useful to people who have their own surgical center. Avoid conflicts. Most important thing is, if you have a conflict, it's not a win-win situation. You may get the money, but you will not be very happy, and you will not create a goodwill. So initially only take informed consent, give a detailed budget, little more than what people are, actually you charge, so that at the end of the day, they will feel better. And get a commitment for payment as to, out of these 50 people who have come, who is ready to commit and sign here that he will pay. Because, if you don't get that signature, nobody will come at the last moment. And as I said, public relation officer, and I'll come to that a little later. So we'll talk about that. So as I said, if you want to have somebody as a public relation officer, initially say you don't have money, so you cannot hire somebody, but you can tell your wife, now how this can be helpful. So, okay, I mean, in your, say in a clinic, you have a place and she's sitting there and nobody knows that she's your wife. Okay, first of all, people will come and ask, and the conversation can start like this, that, oh, where do you come from? Oh, we come from Borivali. Oh, you come all that far. So you know that now you have a reputation. People come to you from far off. Second thing is, oh, it must be very difficult to travel. Like, yeah, it's very difficult. Oh, I also stay in Andheri, and, it's very difficult in today's traffic. So now we have built up a rapport. And then, if you are a handicap, more a rapport. And the advantage is that it appears like, a corporate social responsibility. And you are really helping somebody out, okay? And people usually do not argue with handicapped person. So say a dispute arises, and a handicapped person is there in the nursing home and somebody doesn't want to pay the bill. Then, that person goes, automatically people's, that fighting spirit goes down, and, they don't really bother you. And you may save some money on tax. Now, how it can be done? Well, there are ways of doing it. You can ask. But one thing is, say, for example, you are a member of Lions Club. Lions Club always want to do charity. You give them a lump sum for the whole year of salary for this patient, for this person whom you hired, and tell them to pay them, monthly. You get the tax benefit of 50% straight away, and this person gets a full salary, and it becomes sort of an advantage, win-win situation. Now, as I said, that I had this handicapped girl who would look after my patients, and she would call them up before surgery as to, did you get the admission? After surgery, she would say, how was the surgery? How are things? Then every day she would call them up when they are in the hospital, and then when they get discharged, she would help them out to go home, to get them reappointment. She's available 24/7. And this creates that you are available 24/7. You have somebody looking after you. And this is what I talk about the public relation officer, not somebody who goes, meets the general practitioners. And initially, if you cannot afford, tell your wife or your sister or somebody who can do it. Or, I mean, you go to any arts college and there are girls who are free in the evening, and you tell them that, look, you have to do this on the phone, and they will be really happy to do it. But find a person who is really sympathetic and nice, who can help you. Know your value. Now, most of the times we don't know our value, and I'll tell you how. Like for example, you do a TKR at say charitable institute like Kikabai or whatever it is. How much do you earn? You do the same surgery at Lilavati Hospital. How much do you earn, and what is your value? And you do same surgery at Beach Candy or Ammani's. How much is your value? How much do you earn? Same surgery, same surgeon, going at 3 different places. Your value is different. So this is, you don't know your value actually, and you must know your value. And I'll tell you a small story. I had a patient, and in my initial practice, she had a fractured patella. So I went to her house with X-ray machine, plaster, blah, 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 and everything, and then gave her a plaster and then shifted her. So we were very comfortable. And 20 years down the line, somebody else had some similar problem. They called me and I said, oh, what's the problem? They had a fall. Okay. I sent my technician for X-ray. Then the X-ray came. So I said, I think you need plaster. So somebody went, my ward boy went and gave a slab. And then I went. So the old lady whom I had treated the first time says, doctor, you have become very big. I said, what do you mean? This is first time you used to bring everything, all your X-ray machine and plaster and everything. Now you have so many people working for you. Same person, different presentation, value is more. So know your value. Choose your workplace. As I said, avoid charitable institute near your primary work area because people will not value you. Apple does not sell anything which is second grade. They have everything first grade, and you buy that, right? You pay the price for it. You don't get Apple store which will say, okay, this is our inferior quality, buy it. They will never do it. And select your clinic location wisely accordingly. Go into an affluent area, otherwise you'll never be able to make money. Work in the best places because your value in the eyes of the patient is the hospital you are attached to, where you dress up, your clinic, and all those things. A subtle advertisement. Now, this is something which I learned very recently after retirement. I had a patient, my Bobby, who had a fracture upper end of the humerus, and she went to one of my colleagues, and I went to the hospital to visit her post surgery, and he knew that I'm coming, so he told one of his senior most nurses that to accompany me. Now this nurse probably doesn't know that I'm an orthopedic surgeon, or whether she knew, I don't know. She showed me, I said, how is the patient doing? So she said, she's doing very fine, blah, blah, blah. And she says, would you like to see the X-ray? So I said, yeah, sure, why not? And she showed me the first X-ray and said, oh man, this fracture is, I said, that's a very bad fracture. He says, this post-surgery, see, can you see the fracture line? So beautifully treated. What was it? It was a very, very subtle marketing, right? And it came from whom? It came from somebody who has no X to grind. So, my wife used to sit in the nursing home, and when the patients went in for surgery, the patient relation didn't know that she's my wife, and said, how is the doctor? Is he good? So remember, these are some things which are very important to learn. There is something called ethical marketing, like high-tech clinic you have, and you have certificates and mementos and pictures with big shots, and you have a website. And today everybody has a smartphone. So if your website has a page, say on backache, and if you give a QR code, to the patient printed on the paper, and say, okay, tell your son to scan this. When he does that and he gets straight into your website onto that particular page, it will create a big, big value. And we always want to boast about our, surgical things. So when you put surgical pictures or everything, videos in your clinic, also put something on prevention. So people feel that you are not only wanting to make money. Yes, there is something for prevention. If somebody asks you for prevention, you said, watch my video and this will be good. Now, give more than what is expected. How much time do I have, by the way? Hello? Right? Everybody disappeared. Hello?
Yeah, it's 9:52 as per IST, doctor.
Oh. Okay, I have some time.
Yeah.
I'll take some time. Okay.
Yeah.
But you
yeah.
can hear me. It's going well, no? Okay.
Yeah,
So,
absolutely. Very engaging.
okay. Give more than expected. Now, who doesn't like discounts? Everybody likes discounts, right? So, what we did was in our ethical marketing, we had some budget for advertising. So, how did we use it? We did free pre-op labs. We did free post-op home drop with ambulance. We did post-op home PT free for 5 days. We did post-op suture removal, for the patients. We give them implant ID cards. Now, when the patient said, "Oh, I want, it's too much of money, I want to bargain," we said, "Okay, we'll remove the labs, we'll remove the home drop, we'll not do the PT." And then, they were not happy. So with all this, they become very happy. Now imagine, you are operated at XYZ hospital and you have to take your old mother for suture removal. It'll be so difficult for you to spend that much time. If somebody does it at home, it'll be so much appreciated. So I think these are ethical marketings which we did. And we did, physiotherapy free for most of the patients for 5 days. We were available 24/7. We have 24/7 junior doctors available. Now, what did our therapists do? They were our ambassadors. So they went home and checked up which floor the patient stays on, whether there are stairs or a lift, what type of toilet, knee to foot length, and all these measurements they did. How did it help? It helped us a lot to analyze what problems we could have shifting the patient home, or whether the patient will need additional toilet height, or whether there is an enough physiotherapy place, whether the patient has good vision or hearing. This also enhanced the image because no physiotherapist ever did that. And when my physiotherapist went and did that, patient felt so good. They said, "Why are you doing it?" And they would answer them in detail. And then the therapist would feel, then the patient relation would feel that if this therapist is so much knowledgeable, what must be the level of knowledge of the doctor? So they are your ambassadors. And remember, train them well and do all these things which are important. These are not something which are eye-washing. These are important. Say, for example, your foot to knee length is X and your toilet is lower than that. Post-knee surgery, it will be very difficult for the patient to get up. And if you advise them initially only that, look, because of this, you require a toilet seat extension, they will appreciate a lot. Okay. Now accounting, keep daily account and do daily SIP because every penny counts. And I told you the power of compounding. Always make a budget for what you are, doing. Credit card is your best friend because, you buy for the whole month and pay at the end of the month. So you get 30 days credit. So all the big purchases you do at the beginning of the cycle. So you have 30 days of, freedom with your money. And that money grows. And I think, Amina will vouch for it. So, but always pay the full amount, okay? Don't pay the minimum, otherwise you are in soup. They charge you 50% interest. And depreciation is your best friend. Use it to your advantage because it will reduce your tax paying, and ultimately what you are buying is paid by the government, because you're not paying that much tax. So part of your house also can be considered as an office and you can write it off. Get a good chartered accountant who will help you with that. And leasing and renting items also is beneficial because it appears little expensive, but let's say for example, it's an electronic item and you lease it out. Its life is 3 years. At 1.5 years, you lease, you just give it back, you buy a new one, you get a better model. So this is how it helps. Okay. Enjoy vacation at government expense. So you attend conferences, fellowships, study tours, lecture tours, all the expense that you have, traveling, hotel, and everything is taken care of by the government. You learn and you also enjoy. The fourth decade is you have a lot of time and a lot of money. So enjoy, relax, have good hobbies, constructive and relaxing hobbies, do charity, and enjoy life. And this is a table which Meena gave me. Say for example, you have 10 crores of corpus and you need about X amount of money for your spending. How many years it will last? And at least in my case, it lasted till about 86 years. I don't think I'm going to live that long. And I'll share this table, or Meena can share this with you. And she's from my finance advisor, and she's been there with me till today. Insurance, well, life insurance. If your family, everybody is living long, I won't waste my money on life insurance. If I insure myself, it's only for insurance purpose, but not for returns out of it. But again, it went away. Okay, I think there are only few slides, so I'll just talk, because other reconnection is going to be difficult. So accident insurance you must have, medical indemnity you have. I don't have Mediclaim because I don't think, I put that money in investment, and I don't want to be subservient to those officers. They say, you can't take this room, you cannot do this, you cannot do that. I spend my own money for my health because I think health is wealth, and so I don't waste my money on medical. This is my personal opinion. And where to invest? Well, real estate, FDs, gold, mutual fund, equity. I told you whatever I knew about. Insurance, I told you. Will and inheritance, of course, you must make your will. Write it down everything clearly, because at the end of the day, if anything happens to you, you don't want your family to suffer. So
Yes, sir.
that's it. Okay, I'm done. I'm sorry I took long time, but I got carried away.
Okay, no problem. So Meena Sriram, yeah, hi Meena.
Yeah, hi, doctor. Really
Hi.
nice.
You want to continue where he left off? You want to say something, or shall we directly take questions?
I think one thing
Meena will
which,
say-
yeah, so one thing that I want to, like in the last 12 years after,
Can't hear you.
yeah, you can hear?
Yes, we can hear you.
Okay.
I couldn't hear.
Okay. So in the last 12 years after meeting,
I can't hear.
Okay.
Sir, your remove your headphone. One of your devices has to disconnect.
Okay. Yeah.
Now can
Still
you
I
hear?
can hear.
Yeah.
Okay. Go ahead.
So I will take the thought where Dr. Thakkar mentioned about starting early in life. I think in the last 12 years after meeting so many doctors, like more than 2000 plus doctors, I've seen very few doctors really start early. Because their life cycle, they're extremely busy till the age of 45, 50, and the starting point is much, much later. The starting point has to be much, much earlier, because the power of compounding, what Dr. Thakkar explained, that really works and that really helps you. I think that one, from an investment perspective, very, very important, to be considered as such. And then I think we can take as and when the questions that are coming in.
So we have Dr. Sachin Kale with us.
Yeah, hi.
Hi, sir.
We were there last.
Yeah.
Dr.
Very
Thakkar.
nice,
Yeah, very nice.
a very nice lecture by the sir, especially the first decade, second decade, third decade, and fourth decade. The explanation of the orthopedic surgeon. Nice. Can sir hear me?
Yeah, I can.
So when you started investing predominantly in the mutual funds and the shares quite early, as Meena madam said?
I started actually with equity because, initially I was a high risk taker, and fortunately, I had no issue of money like most of the people have. So, and also I had my father who used to invest in equity. So I started in equity first, mutual fund later. Yes. But my advice here is totally different, for people. See, I'm considering a person who starts with nothing. And that's what my idea was, to build up the whole presentation.
Yeah.
Nice. Thank you, sir.
So risk appetite should be when you have enough money where you can afford to lose certain, not in the initial period. Initial period, conserve your capital as much as you can.
Can I add one, Dr. Thakkar here? Can I add one thing? Like,
yeah.
Reference to our, I think that will be related to, that can add to Dr. Sachin's question also. When we met Dr. Thakkar, I had a meeting with him and we prepared the cash flow statement, that's where there were certain surpluses that were, that can be done. There were savings at the end of every month. And then with that saving, what I could see is that every year that saving amount kept on increasing and the SIPs were done out of it. Like prior to that, that savings probably was lying and then used to get, invested either in lump sums side, but the SIP formed a method. Like for the, I would say 5 to 6 years, it really happened in a very systematic, disciplined manner. So that is also very important. So when you start, you have to actually sit down and analyze your cash flow statements and then start the investments as to how much is really possible.
But Meena, unfortunately, we are never taught accounting. And that's why I said that you must have, every day in the evening, you must have an account statement available to you. So you know how much is the money that is lying with you.
Correct.
Yeah.
Correct.
But that's not taught to us.
Correct. And actually doctors tell me, oh, can I save so much? I said, yeah, this is available for you and you can really do it. Yeah.
Exactly.
Yeah.
Sachin, you have any more things to ask? You're muted.
No. As I told, a very nice lecture by sir, especially the few tips I've experienced, like not to have a charitable hospital near your clinic, and small things like as experience counts.
So I want to ask Neeraj and all other colleagues who are listening to me as to, I mean, what I talked about, did it make any sense, or you thought it was something which was not necessary?
No, it was definitely necessary. It is in fact more useful for people who have not started investing yet and who have just started practice and thinking whether I should take a loan, whether I should open a clinic, whether I should invest in mutual fund. You know, there are these guys nowadays in my building. They are son of businessmen. And recently in a social gathering during Holi, I think, when the Holi was there was no lockdown, right? Am I right?
No, yeah. There was no lockdown.
So during Holi, when there was lunch happening, when I had gone to take my lunch down, I don't play Holi. So I saw them discussing, these young guys who are at least 15 years younger to me, if not more. They were talking about mutual fund investments. And they had started investing at the age of 20, 25. And though they were investing a very small amount, like per month, 5,000 or 10,000 rupees, and they were thinking of increasing the investment to 20,000. And one of them was saying, "Agar main 20,000 dalunga, to fir khaunga kya?" Well, his salary was only 25,000. He was still managing to invest 5 to 10,000 every month. So that was a very big thing, basically, which I understood that I have started very late. But I feel it is never late to start. Basically, that whatever time you start, that is what, you know,
I read a very nice book in 2009 about Millionaire Next Door. And that is where they have clearly written that doctors, they are so busy in their life, learning and everything, the finance comes very last, you know. First of all, you are not earning enough when you are studying and you start your practice very late. And then, you know, again at that stage, your thought is only how I can do more surgeries, how I can do this, how I can do more. But when the money comes, they don't even know how much they have or how to save it or how to invest it. Nobody teaches us. And we started around 30, 35 when we realize that, oh, abhi paisa kabhi invest karu. Till that time, you are just in dark.
Correct. Very true. Even that 2000, the example that you gave in the presentation, I think that can be a starting point for someone at 30, 35. So you don't need a big amount to start. You can always start with whatever is available with you. Yeah.
But I would really like to have a feedback from all the colleagues who attended today, whether these tips of my practice, which I suggested, this is how I sort of build up, whether it had any value or they really wanted to hear the same story, which, you know, the finance people tell you about mutual fund investment, this, that. I just made it different, that how, as a doctor, one could build up the practice.
No, sir, your tips were very different from others, because they will talk on all now. They will talk, you already have money and now you have to invest. You are talking is how to build money from your practice. Other people are talking about how to build passive income. You are talking about how to build your active income and then later on go on to passive income. So main take home points which I felt was that basically you should have the latest technology accessible to you if you can afford it. Even if you cannot afford it, then at least you should develop some subspecialty skill that is going to take you higher than others. And then there are many small tips which are there as a part of the lecture, so it is very difficult for me to say.
I know.
Sachin also told that basically your clinic should be away from a charitable hospital, because then the competition will always be a charitable hospital. And if you don't bargain, and people will not bargain with you. That is basically, I think, the law of the land. So you
Yeah.
stop bargaining and people will stop bargaining with you. And of course, most important, your anesthetist is here. I think that is the reason you said that you always pay good for your good money to a good anesthetist, and don't
No, it
undercut.
was not, it's right from my first day. I had this, that, okay, these are the people who save my patients, and I'm going to pay them well, So I always paid them well. I never told them that I have a poor Arab patient.
So in a general social media workshop which I attended, we had a training, we had just a team session where basically everybody will give feedback on what your social media should show. And the only feedback which I got from 3 different people was the same, that recovery period and post-operative pain. Everybody is only worried about that. Okay, how much will be the recovery period of the surgery and how much will be the post-operative pain. And the post-operative pain is mainly taken care by the anesthetist, which is a very
I'll
important
share you a
factor
very
in
nice
today's day.
experience. I had a young boy whom I was treating, and he had to undergo multiple surgery. And one of the surgeries was very simple, something very minor. And I had given it to my assistant. And, when the surgery got over and when he came out of anesthesia, he said, "Doctor, you did not operate on me." I said, "How do you say so?" He says, "My dressing was very tight. Your dressings were always so comfortable." So, all these small little things people understand, and then they analyze, which we don't know. So people are very smart.
Okay, sir. Thank you very much. Thank you, Meena, for being
Thank
there
you,
again. Yeah.
Yeah.
And
Thank you so
Dr. CJ Thakkar. And next week, again, I think we have a succession planning.
Succession
on
planning,
Friday. Yeah. Succession planning. And it will be an interesting talk, as Dr. CJ Thakkar said, that we should all make a will at whatever age it is. And those questions, I think, will be answered next week.
Yes.
Thank you very much. And see you,
Thank
everyone.
you so much.
Yeah,
Thank you,
Financial
Doctor.
Friday next week.
I really
Thanks,
loved
Meena.
your
Thanks for
PPT.
joining.
Thank you so much. I really enjoyed it, and it was really